The Meyer-Hake company was founded in 1981. After years of imported products, mainly from the USA, an independent line of products was started in the late 80s. All of Meyer-Hake's products are developed in cooperation with doctors and are known for their high practicability. Already in 1995, Meyer-Hake established a quality assurance management and was certified. This established the prerequisite to affix the CE mark to products. In December 1995, the authorization to market the tissue adhesive and suture substitute EpiGlue was granted. EpiGlue is a medical product class 2B and can be distributed on the basis of the authorization according to the Medical Device Act within the European Community without further registration formalities. The pertaining committees of the European Union in Brussels are striving for a global harmonization of the European Medical Device Act with the laws of non-European countries. The suitability of cyanoethyls used as tissue adhesive was already confirmed during the 60s in numerous publications at home and abroad. But the difficult handling and sometimes short shelf life of the early adhesives caused a slow acceptation of their use in the medical field, even though their excellent properties were noted repeatedly. Further uncertainty was caused by the so-called superglues, which resembled the cyanoethyls in their adhesive strength but were unsuited for the medical field because of their toxicity. EpiGlue is offered in 3-gram tubes, which are intended for multiple use, and in dosettes containing 0.3 ml. The adhesive is now dripped into one of the depressions of the pallet to allow an easier filling of the disposable dosing pipettes. The dosing pipettes allow for an exact application of the tissue adhesive. Only one tube is opened at a time. The content is sufficient for at least 20 applications with several layers. The tube cap has to be unscrewed completely. Unseal the tube by punching the tip of the cap into the seal. Screw the complete cap on again and remove the upper cap. EpiGlue is now ready to use. Avoid squeezing the tube during the opening process. Now 1 to 3 drops are placed into one of the depressions of the pallet and soaked up with a dispensing pipette. This allows for an exact application of the adhesive. The pallets are replaced by the new drop-in trays. One tray has to be broken off, filled with the adhesive and thrown away after use. The pipette can also be cut with a scalpel and placed directly onto the tube. This method also allows for an exact dosing. For the usage in the operations theater, sterile application sets are available, containing 1 pallet and 1 pipette. Close the tube by placing the upper cap loosely on it after use. Place the tube in the perforated opening of the box and store it in the refrigerator, or even better, in the deep freezer. Cold storage prolongs the shelf life of EpiGlue, and since it will not freeze into a solid block, it may even be used coming directly from the freezer. A chain of cold storage during the transport of EpiGlue is not necessary, and also not for the repeated use within a day in big private practices or emergency rooms. Especially if EpiGlue is not commonly used, we recommend to store opened or unopened tubes as cold as possible. The solution has to flow from the tube or dosette in a crystal clear consistency. Discontinue the use of EpiGlue once it does not flow from the tube like water any longer. If the tip should stick together after several uses, cut this area off. The peel-off pouch gets opened and the dosette is taken out. Hold the lower part of the dosette and screw off the upper part. The drip opening of the dosette is held downwards and EpiGlue can be applied to the adapted wound by slightly pressing the filling body. With the even surface of the twisted off upper part of the dosette, the adhesive can be smoothed out thinly on the wound. The first layer polymerizes within seconds. Following, a second layer, overlapping the first layer, is applied and also smoothed out thinly so it does not detach off the healthy skin. When smoothed out thinly, the adhesive becomes particularly tear-proof. The thinner the adhesive is smoothed out, the tear-proof it gets, and the less it detaches off the healthy skin. If necessary, the procedure can be repeated for a third layer. It is also possible to smooth out the adhesive thinly with the tips of the before shown pipette. The usage of the dosettes is shown in graphics on the reverse side of the aluminium pouch. The dosettes are containing 0.3 ml solution which is sufficient for a wound length of 10 cm. EpiGlue as single dose has to be stored in the same way as EpiGlue in tubes and has the same shelf life. The adhesive has to drip out of the dosettes in a clear consistency. Stop using it when it does not flow like water any longer. If any adhesive has gotten on garments, instruments or healthy skin, it can easily be removed with Cyano-X. A contact of Cyano-X with the wound must be avoided under any circumstances. EpiGlue can be used for any fresh cut, laceration and surgical incision and for the wound treatment after the removal of skin lesions. Stored in the deep freezer, EpiGlue has a shelf life of 3 years and can therefore also be used in practices in which wound treatments are not so common. The material provides no culture medium for germs and even has an inhibiting effect on existing germs. The tissue adhesive is a one-component material which polymerizes when in contact with wound liquid while absorbing OH ions. Patients of every age appreciate a stress-free wound treatment without anesthetic injections or burning sensation. Especially mothers who have heard of the adhesion technique insists on its application. The patients are free of pain and are immediately able to work or play again. The wound healing occurs fast without infections, minimal scar formation and also keloids develop rarely. Allergic reactions are unknown. The treatment of a wound with an approximate length of 10 cm takes 55 minutes with traditional treatment, including the preparation, anesthesia, sutures, instruments and removal of the stitches. With the tissue adhesive EpiGlue it only takes 10 minutes. Especially in rural territories, it is a big advantage for the patients that it's not necessary to go to a second appointment for the removal of the stitches, for EpiGlue detaches itself from the skin like scab after the healing process.